NHS England states that 3.8 million people were in contact with the NHS mental health services over the last year. That's up from 2.7 million in 2019. So we can all see the trend, and there's no signs of this slowing down anytime soon. On top of this, waiting lists and waiting times are at an all-time high, with services overstretched and clinical teams constantly at full capacity. Now, these services want to reduce waiting times and waiting lists, but currently the only answer is more resource. So here's the good news. At XR Therapeutics, we have a fantastic solution to support these services, and more importantly, the clinicians at the front end providing treatment. Following on from 10 years worth of clinical and academic research, we created an immersive platform that supercharges treatment for anxiety disorders, PTSD and trauma, and low mood and depression. How, I hear you ask? Well, currently, therapists will speak with a patient on a one-to-one basis, and 70% of this time it's done remotely. Often during treatment, therapists will use imaginal exposure to get to the root cause of a condition, and this is where our technology comes in. The therapist shares screen like you would on Teams or Zoom and can introduce an environment to support therapy. To put this into context, let's think of a social anxiety. The therapist introduces a cafe, but has full control of the whole environment, i.e. they decide how many people are in there, how loud it is, and whether you are sitting or standing. Now, there are competitors in the space. However, they're all headset based and they tend to focus on one specific area, such as psychosis. What makes us stand out is that we have a vast library of over 70 different environments, and it's device agnostic, with not a headset in sight. So no hardware costs, and it allows patients to access this from anywhere, on any device, including in their own home on their own TV. The benefits for patients and services are amazing. Patients get seen faster and discharged quicker, as on average, patients are being discharged after just 2 to 3 sessions. Meaning that for someone who can't leave their house, they can now socialise with friends, or go to work, or use public transport. For services, this huge efficiency gain allows therapists to see more people, but also therapists get to enjoy working with a new environment for every session. And services using our technology say their favourite sessions are the ones when they're using our technology. We're already working with several NHS trusts, including Sheffield Children's Hospital, Greater Manchester Mental Health Trust, and our latest trust to onboard, South West London. We're more than happy for you to speak to any of your colleagues in any of these trusts, and they can tell you the benefits of using immersive technology to supercharge treatment. Thank you.